You're live. Okay, would you like me to get you started?
Yes,
Because my voice.
yes, Katie, that would be fantastic.
Okay.
You could get started on the new version.
No problem. Katie McGlynn, Office of Legislative Counsel for the record. There is a new draft 2.1 that I believe you have. So I'll pull it up so you can follow along. Where did my Zoom link go? It was on Zoom, but now I'm not. Oh goodness. Okay, well. Let's do that.
Working.
It's logging me in, yeah. They must have connected and then unconnected myself. So. For what it's worth, here we go.
It's worth a lot.
So here's draft 2.1. This is similar to a version you previously looked at, with some changes highlighted in yellow. So you still have the same findings section, and then we have the Rare Disease Advisory Council, with some changes to the membership. So previously the appointments were happening by the Committee on Committees or the Speaker of the House, and now many of those have been replaced with the Commissioner of Health making the appointments. So we have the Commissioner of Health making the appointment for the two individuals with lived experience, the parent or guardian of a person with a lived experience, the academic researcher. The pharmacist appointment is being made by the Vermont Pharmacists Association. Geneticist is appointed by the Commissioner of Health. And then this new language, any other person deemed necessary by the Commissioner of Health. And then we have a new subdivision 2 that members of the advisory council shall be appointed for staggered 5-year terms. Any midterm vacancy shall be filled by the appointing authority for the remainder of the unexpired term. Term shall begin on January 1 of the year of the appointment and conclude on December 31st of the last year of the member's appointment. And members of the advisory council may serve multiple terms, either consecutively or intermittently. And then there was this language in subdivision 3. The advisory council may, instead of shall, collaborate with other stakeholders as it deems appropriate, including National Organization for Rare Diseases. Under powers and duties, few changes. And subdivision 3, in consultation with experts on rare diseases, develop and provide policy recommendations that identify conditions for the Department of Health to consider as part of appropriate screening guidance and recommendations. And then have an and added there. Assistance. The advisory council shall have the administrative, technical, and legal assistance of the Department of Health. I know the Department of Health wanted to limit the type of assistance, but we didn't fine tune what the list would look like of what the limitations would be. So I left it as is for the time being. The department shall maintain a webpage on its website that contains notices of upcoming meetings, meeting minutes, public comments, and reports. And then we have a reference to the open meeting law that the meetings shall be held quarterly, in accordance with Vermont open meeting law. And then we have this top of page 6, the section 3 on long COVID. And this has had some changes. So the title, long COVID resources for primary care providers and patients, autonomic instead of automatic, which everybody was very kind to flag for me. I appreciate it. And subdivision 2, rewriting this so that one of the goals of this group is to recommend support services for long COVID that include a range of peer and community-based programs, such as long COVID support groups through the University of Vermont Medical Center, the Vermont Center for Independent Living, or another entity, and strategies to support patients who are homebound or at risk of becoming homebound. And then we have a definition of what is meant by long COVID. Those are the changes. You did receive some markups from the Department of Health. So those are not integrated here, but I'm sure you'll be curious about those as well.
And they're here, so maybe why don't we ask the committee first thoughts on the first section? Because
This is what came, so what we have here, I'm okay with all.
the rare diseases.
From Heather Ferguson, that one.
Most of these changes in section 2 are from the health department.
Okay. And I'm okay with that.
All right, so this is department, with the department, these are all that.
Lisa, I don't know if you can hear that, but if you have any comments to make on the most recent draft?
I do not, but I'd also look to Jessica to see if there's anything additional.
Jessica Chifano, Department of Health. For the record, Jessica Chifano, Department of Health, and thank you for hearing our suggestions from last week and incorporating that markup into this version of the bill. We've got the Rare Disease Advisory Council portion of the bill has incorporated what we have recommended, so we're good with that part of it. For the long COVID section of the bill, I know that last week I mentioned we want to have some comments on this, and our concern is with that piece is that there are many existing resources that are currently available for treatment standards and best practices and training as well as support. So we don't want to reinvent the wheel here in Vermont for that. And the Department of Health also is not positioned to create clinical guidance on this issue. We always look to best practices from other medical authorities. So we would propose some change to the language to focus on identifying existing treatment standards, best practices, and training, and sharing those resources. And also just the same thing about identifying those existing support services and making those resources available through the department's website. I shared a preview of the language with Katie. I had sent it to the committee. I was waiting for Dale to weigh in since they have will be our collaborators on pieces of this. And I haven't gotten their feedback yet, but I can send you the language that we discussed within the department with a caveat that Dale may also want to weigh in on it.
Yeah, and I do know that the VCIL, Vermont Center for Independent Living is very much involved right now with a support group for those looking at existing and emerging support. So it's both existing and emerging and going on for a while. But I agree with you. Don't reinvent the wheel. Understand completely. The other concern I had about language that you said, you did share that, I appreciate it. So it's only putting the information up on your website, but having it shared through the folks who are treating or supporting those.
Disseminate information.
Yeah. Website isn't gonna do it for people who. And then.
To send it to primary care docs or.
That's kind of what I was thinking. We have language.
Okay. Okay, and I can also take that question back to and see if there are existing mechanisms for communicating these things with providers. I know we do
That's good.
ponds and other things, but we
Yeah.
can certainly figure out what the best communication mechanism is to get these resources to the primary care community.
But I think that would be the most helpful.
Okay,
Yeah.
okay,
Thank you.
we can see, we can do about that.
Wonderful. So do you want to link Katie in with? And then we'll look at the bill next time, hopefully we can handle how it's not whether which changes. Well, thank you.
Thank you.
Yeah.
Oh, goody. Darn, I wish we could do that right now, but we can't. It's really honest. Katie, is there anything else we need to know about this bill?
No, I mean, I have the language that the health department emailed me if you wanted to see what it looks like. It looks like you're sort of pivoting. Okay,
Don't make me laugh.
okay.
Don't make me talk. Sorry. Sorry, you're so.
Trying to be you are my voice, so, okay.
Okay, so this is the markup from the health department. And it sounds like maybe these edits are already out of date. Oh, bigger.
Yeah.
Um,
Great, thank you.
but there is an interest in having it read that by January 1 of 27, the health department shall identify existing evidence-informed treatment standards, best practices, and training for primary care providers regarding long COVID and share these resources through the department's website. And in collaboration with Dale, identify support services for long COVID that include a range of care and community-based programs, etc. So those are the changes, and it sounds like there'll be new changes. So I can integrate that when I get it. Thank you.
All right, any other questions on this bill, H46? All right, well, thank you, Elisa. Thank you, Katie. The last order of business we have is to discuss a budget request from the Service Supported Housing Fund base.
So we need to wait for Polly.
This believe Polly is
Coming in person.
anticipated 11:45.
Right, that's fine. Is she out to the hallway?
No, she was not.
Okay, then we'll just.
Kristen, was she gonna come in person or over Zoom?
I don't know the answer to that, I'm afraid.
That's all right.